Good morning, Dr. Oliver Rivero-Arias. First of all, thank you for joining us in today's interview series organized by the International Health Economists Association, ECR Special Interest Group. This series of interviews explore different career paths in health economics to provide an overview of the variety of topics and areas where health economics is applied. Dr. Oliver Rivero has an awesome career profile, spanning across academics, public policy engagement to journalism. A DPhil in public health from the University of Oxford. You are the senior health economist at the Perinatal Epidemiology Unit. You are actively involved in teaching and postgraduate supervisors. You are an independent member of the UK National Screening Program. You are also a co-editor-in-chief of the academic journal Health and Quality of Life Outcome. So, from here, let's start.
Thanks, Gopa. Thank you. Thanks a lot for having me today. It's a pleasure to share this time with you.
So, can you tell us about your research journey, first of all?
Well, again, thanks, Gopa, for the invitation, and I'm looking forward to our conversation today. So I started in health economics over 20 years ago. So I'm originally from Spain, from a group of islands that they are called the Canary Islands, and in particular from an island called Gran Canaria. So I did my degree. My first degree was in economics, and I was very lucky to have a couple of professors who were well-known health economists back home. So obviously they directed a little bit some of the interest, particularly because I wanted to be a doctor. I always wanted to be a doctor. I couldn't study medicine. And then I found out because of this group of professors, there was something called health economics, and that was a potential career option. So after I did my degree, I applied to study a master's in health economics at the University of York. And then as part of that program, we had the opportunity to spend a summer placement elsewhere. So I didn't have a clear idea of what I wanted to do at that time, but the placement I chose, it was based in Oxford. So I came here to Oxford to do a summer placement in the summer of 2000, and it must have been the summer of 2002. And then at the end of my summer placement, I really enjoyed what I did here with the project I was involved, which I remember it was about different techniques, physiotherapy techniques with low back pain, under the supervision of Professor Alistair Gray, who used to be the director of the Health Economics Research Center, where my career started. Right. So I did that one, and at the end of the sort of MSc, I started looking for jobs here in the UK. And I was lucky enough that there was a post advertised as a research assistant here at the Health Economics Research Center. And that is exactly what I guess where I was a little bit more immersed in what research was going to be. But until that point, I probably didn't know well what I was getting into.
So the transformation from a doctor to a researcher, economic researcher. Yeah. How was the experience?
How was that? Okay. So I worked as a research assistant for a few years. So I spent my time, at that time, I spent quite a bit of time working in different projects, and I was exposed to a range of methodologies. In the area particularly was to do with economic evaluation of interventions in healthcare. So I was exposed to different methodologies, and the Health Economist Research Center has always been very good at conducting cost effectiveness analysis using patient level data and modeling. So I spent time working on different projects in different disease areas. I was a junior at that time. Essentially, we was assistant to whatever I was told to do. I wasn't leading anything at that time. So I was exposed to working with data sets really early, and I got and I always had an interest in sort of methods, and I like mathematics. And I remember I did enjoy all the quantitative modules when I did my degree and doing the MSc. So I started learning sort of statistical programming, and I moved quite, I guess, early. But at that time must have been, well, it was Stata, where I started to get sort of my hands on how to program in the Stata. And then after a few years, doing and working in projects, I discussed with my supervisor at that time, Professor Alistair Gray, the possibility of moving into something better, or well, just something else in terms of career progression. So the most sensible move would have been, now that I had some experience, I had a couple of publications, you just see whether you wanted to do a specific research project. And I had been exposed to a trial that it was a multinational trial. It was the ICERT study, which looked at a comparison of surgery and endovascular treatments for people with subarachnoid hemorrhage. It's a quite milestone trial that changed practice in the UK and elsewhere, because demonstrated the value of using endovascular treatment for this group of patients. So I had been doing the economic evaluation of that one. It was multinational, and at that time, there were certain things that had to still keep explored. So I put an application for what it was then, what was actually what is now, is the NIHR Doctoral Research Fellowships.
Okay.
And I got that. I got the money to do my own sort of piece of research, and that's how I became a doctor. And again, I did that here in Oxford.
Yeah. So, what were the main challenges you faced from in research this thing while doing the research? Because now you get lots of tools like our software, startup. At that time, it was not there, no?
Well, that's I guess I'm not that old.
I'm sorry.
I'm old, but I'm old. But at that no, but at that time we had a state. This is true. We don't have the same modules that
Model,
you got
yeah.
now to do a statistical analysis, and you had to program some of it. So, but if I can identify challenges, I would say yes, that there were different, and you're completely right. You're correct. So there are different layers of challenges that I faced when I started. The first one was, for me in personal, was a language barrier. So obviously coming from Spain, and although I could read and I guess mumble a little bit of English at that time, I was not quite, I guess, confident as I am now. And it took me sometimes to get to a level where I felt that I could sort of contribute to discussions and things like that. So I got a lot of sympathy. So when I'm in the room and I can see new researchers or people coming from different countries, so I definitely understand where they're coming from. So that was one of the first challenges here when I was in Oxford. So, and that one, actually, that the only thing you can do with that is you are embedded in a research center, and then you just go with your doing presentations and your day-to-day life. So then there was the other element about when you finish your MSc, although you've been given a range of tools, you haven't explored these tools in depth. You don't have enough time to just get to understand how these tools work, what are the limitations, how you can, interact with them and making part of your toolbox. So the second part was getting to know how to be a researcher. And that involves not only knowing the concepts and the theory, but it's also how you apply them and how you interpret them, and then how you understand what are the limitations. And that were the two key I guess, elements that took substantial amount of time until you felt that you were in a level where you could potentially start talking about it, or at least raising and asking questions about it. And then you're correct, things have changed since we started. I remember when I started, I started with SPSS. I moved really quickly to Stata. The people I was working with, they were working in Stata at that time, so I adopted that. I really enjoy the program. But it was not only Stata. I remember references, how you were dealing with references. We were using something called Reference Manager, which worked really well, then was bought by EndNote. And even the tools for word processing were quite developed by then, but obviously they've got better, and you just learn how to interact with them more often. So I guess it's a whole way of things that you have to learn until you get confident that at least you know what people are talking about, or you are not an expert in any particular topic at that time, but at least you know what they are talking about, so you can contribute to those discussions. So I guess that would be sort of my major challenges when I started just trying to find my way through things in a respectful manner.
Now, also, the main challenge is to get the information, basic tools. You have to know the programming languages, and that's one of the challenges.
Yeah.
Now, your research is mainly centered on maternal and child health. Tell us something about it. How
Yeah.
you choose the research topic.
Well, it's an interesting, very interesting question on a personal level. I think more than a professional level. So what happened after I finished my PhD, and then after finishing my PhD, I started to be what it would be this, I guess, a postdoc in HERC, in the Health Economics Research Center then. And I was doing that for a couple of years. And I really again, at that time, once you finish your PhD, you start obviously probably leading some research projects, that you start having more control about what happened to those research projects. You still go your supervisors, but you are given sort of more freedom on that. So I did that for a couple of years. And around, obviously, in 2013, there was this opportunity in one of the health economics teams in Oxford. Oxford got a different health economics team. And originally we had two. One is this one, the one that I lead now, which is on the National Perinatal Epidemiology Unit, that has been led by different researchers over the years. And then there was this post about leading this team, because the previous senior health economist, which was Stavros Petrou, he had moved to lead a unit in Warwick, and then obviously now he's, at the time that we're doing this interview, he's a professor of economics here back in Oxford, leading the group in primary healthcare sciences. So I applied to the job, and to be honest, until that time, I had very little experience in maternal and child health. I had done some mapping work where we were trying to translate certain outcomes into utilities that then you use for quality of adjusted life years. And I had been involved in the only one, I think, before I got to the post, I had been involved in a mapping study to transform the PETSQL data into, I think, EQ5D data. At that time, that was years ago. But what happened that year is that I became a father. So I had my first child. Mm-hmm. And I think that had something to do with it. Now, obviously, thinking back, it's not, I wouldn't say that I don't know, it's just difficult, but it had something to do being, obviously, having someone to care for. And then you realize how, at least in my case, you realize that there are certain aspects of life where health economics can actually help making decisions that are better for pregnant women and their families, and I got an interest in that. So I went for the job, and I got the job, and that's the job that I've been doing since 2013 here at the University of Oxford.
Can you please tell us the latest project you are doing, currently doing research?
Well, I don't lead one project. I lead a portfolio of projects. That's one of the challenges of having a team. So I lead a team. So we are 5 people, and then we've got a couple of other PhD students. And essentially, the business model for us is that we are involved in research projects, and some of these research projects obviously brings funding, and then you go to employ people and be able to do the job. So we have a close collaboration with the NPEU Clinical Trials Unit. So we do quite a lot of work on clinical trials, and at the moment we are working in several clinical trials, some of them very large, and some of them expanding different countries. And all the work that we do relates to improving the care and outcomes that for mothers and babies. And we do a lot of work in premature babies. So we are working with different trials to look at from how to feed babies, how to give them better support to improve their respiratory systems when they are sort of premature. And then, so this is in terms of sort of the trials. And in terms of pregnancy, we do several trials, and we got a whole program of work on hypertension and how to manage and treat hypertension during pregnancy and post-pregnancy. So there are several projects on that as well. So obviously then the team sort of that we have, I oversee the program of work. I do get involved in aspects of everything. I like getting my hands on data. I like the whole thing of being able to, do things with better way. I moved a couple of years ago to R, although I'm still a heavy data user. I do certain things in R now, and I'm still sort of, I wouldn't say a novice, but I'm getting my step into getting my transition fully to R. And we also got some work that come through the Policy Research Unit. So the Policy Research Unit is a amount of funding that we receive from the Department of Health, and we help them making better decisions. And there are some projects associated to it. And then personally, I have a personal interest on how to measure and value health for decision making, and I have an interest in doing that for young populations, sort of babies, children, and adolescents. So there is a little bit going on.
Yeah, that is the beauty of health economics, where we can use the health health variables to economics, and we can see how it works in life. So, as you mentioned, you are doing in public policy engagement. What are your experience with policymakers with your projects, and how are
We are quite lucky that we have what I mentioned before is a policy research unit, and essentially is funding that we receive to conduct research projects with a policy-oriented focus in helping the Department of Health making certain decisions. So there's a whole program of work, and some of those projects are sort of health economics. So, for example, clearly recently we've been working in a couple of projects about health inequalities that the Department of Health got quite a lot of interest. So my experience working, so this is a quite direct way of working with policymakers. We have conversations with them. They sort of come to us. We talk and we try to find a common ground in the needs that they have, and how whatever needs they have can be translated into a researchable question, and then from there you develop the project. So my experience, obviously, I guess there are positive and negative experiences, like in anything, but the conversation with policymakers is slightly different than when you have with a researcher, and it always comes and goes depending on the political environment at that time. So things can change quite quickly, and because of that, at least in the conversation that we have with them, and this unit, this policy research unit, is that they can come with the need of having an answer very quickly, and that obviously is slightly different from the standard approach that you want to do things properly, you want to have rigor, and then you need to manage and address all these expectations. The good news is that at least the work that we do, we know that is read by the Department of Health, and in some cases it's used to inform policy. So I guess it's a positive outcome for everyone.
Yeah, so our that's the beauty, our research finally it impacts positively to the society, to the
Exactly.
people it will.
Yeah.
So as I mentioned earlier, you are the co-editor-in-chief of academic journal Health and Quality of Life Outcomes. Can you please tell our listeners who are trying to publish their articles in journals, what are the main features editors look for a research article? And can you also give some tips to improve their research article for getting published?
Okay. So every journal has their own objectives and remits. So obviously, it's, in health economics, we've got the sort of usual suspects. We've got health economics, general health economics, running health, pharmacoeconomics, and others. And each of them has an interest on a research question and what they want to see on the journal. So in our journal, for example, we have a focus on measuring and valuing health. So we're interested in, from the theoretical aspects of how you construct and measure health, to develop new questionnaires, and then how you value it in terms of understanding how people value those health states, and then you can use for decision making. So that's the sort of our sort of interest. So I guess editors in general, I mean, good editors, they want a good story. So when I receiving a paper, what I would like to see is a good story, and that, although it sounds quite obvious, is not that obvious when you try to put it in a research paper. And there is a lot nowadays that is done on a sort of routine basis type of thing, and people forget that anything that you want to publish, it needs to have something of you. So the first thing is a good story. The second one, it's you need to have done it with rigor. And that rigor is extremely important if you are a good researcher. And the way of getting rigor is that you need to know well the methods, you need to know well how to use the methodology, understand the limitations, and make sure that when you're writing your papers, you are bringing that on, that definitely you are making that clear, that you know the methodology that you're using. And then there are aspects of sort of good practices, like ethics, good referencing, knowing that you definitely have read everything before it has been done. And that, particularly in journals like mine, where we are not publishing anything that is going to have a direct implication on patients. I mean, our work, it might then be used to understand sort of treatment effect elsewhere. It is quite important, because otherwise you get quite a lot of papers that they are going in the same line. So that would be my sort of my tips, and what editors might actually look in an article is good story, academic rigor, good good practice in terms of ethics and everything surrounding that you have done, from security of, from the data security or from the funding or the security of the funding to this dissemination. And of course, good academic writing. And that's something that it's very important that the story flows in a nice way. So in terms of tip for career and early researchers, papers, at least academic papers, they've always they're always seen like this, a standard way of writing a paper where you've got the introduction, methods, results, and discussion. But then within each of these areas, you need to know how to get better into placing your thoughts on the paper and that you are covering everything. So I guess read as much as you can from the area, that you just find authors that you like how they write. Just try to see how they present their work, make use of obviously how you present the data. That's where it's going to be a massive advantage to you if you know how to make use of good tables, how to present data from statistics in an engaging manner, make use of figures that speak for themselves, that they tell a story, and that would be just find articles that actually on that. And you can use, and there are seminal articles that you can use for that. In health economics, we are lucky that we bring different aspects. It's a multidisciplinary work, so you will end up looking at really good medical journal articles, so you got something about how to disseminate clinical information. You got from epidemiology and stats, so you can bring that in here. And well, obviously you got sort of traditional economics, so you can learn from everyone together. Get into training courses, how to write properly, how to, if I had done something now, if I need to do something from scratch, I would try to be really good with graphic tools like ggplot in R, or even Stata. In the Stata, the graphics interface is really, really powerful. Know how to build those things, how to make things sort of visual. That obviously works for me, not for everyone. And get do something about the storytelling. Get some training on storytelling. What is the key objective of your paper? What's the key result in your paper? What's the key message that you want to send through? And then, and this is something that I think it's important, although personally I've always found it challenging to do, is that things shouldn't stop with the paper. Then your paper needs to, you need to engage others with your paper. And obviously now you've got a lot of tools from social media. There are different ways where you can even publish small synopses and summaries of what you've done, position papers, things like the conversation, and get that as part of your tool and training. Yeah.
So it's like a good story. Starting till the end, it should engage the reader.
Exactly.
All
Yeah.
the details. So can you give also a tip to choose a good research question for the paper? How to choose a good research question?
Yeah, I guess this one, people come across with research questions from different angles. So you can be exposed to them because you've got, obviously you work in a particular disease condition, and you understand what areas and what are the gaps in the knowledge base for, in terms of health economics, potential health economics questions of interest. And then the other one is personal sort of interest, and you can have a personal interest in a particular topic. Like for example, in my experience and many of the people I work with, some of the research questions that we come across is because we face a practical problem. So for instance, And we always had this recurrent challenge of extrapolate results to the future, understanding trajectories and pathways from premature babies to the future. So, so before, I mean, a few years back, I would say a decade or so back, when we didn't have the amount of record linkage that happened at the moment, you had to use a lot of assumptions, data from the literature, if it was available, prospective cohort studies. But once you've got now record linkage and hospital records that allows you to look to the future, you can obviously answer research questions because the mean is actually down there. So you are there in order to sort of to do it. So clearly, if you got an interest in a particular area, you know what has been done and what needs to be done. As well. But I personally think that it's practical problems that lead to key developments when you as a researcher face issues, and then you know that you need to basically sort them out. Yeah.
So like one research question leads to another research question.
Oh, yeah,
So the
exactly,
paper can lead to multiple dimensions of different papers. One research paper can.
And that's correct. It's unlikely that you answer all research questions in one paper, and that's where, as a researcher, you realize that this, as you mentioned, can be linked to another research question or another project, and that's how you start making, obviously, all these contributions little by little. So, as an example, for instance, because I work in perinatal health, we until very recently, we didn't have any way of measuring quality of life in babies. So when I started, obviously there were theoretical advancements and how you can do it, but now we have tools that allows you to measure it, and I'm proud to see that I've seen some of these developments and I have contributed to some of these sort of developments, for example.
A beautiful concept of health economics. So now I'd like to ask, how do you envision the future of health economics as an academic discipline? Because before COVID, health economics was not given that stature all over the world. But after COVID, I can see emergence of new studies, especially in developing countries, on focusing on health economics. So how do you see the future evolution of health economics as a subject?
I see. Okay. I guess to answer that question, I guess I would need to separate a bit between health economics as a big sort of discipline that covers all elements of health economics that goes from traditional consumer theory to evaluation, cost effectiveness, and similar. So you are correct that the world has seen a few changes and events that have made people more aware on a global scale. I think countries such as, well, probably more developed countries such as the US, they had an evaluative culture, and some of the traditional methods of health economics have been used for obviously a long time. But you are correct that that's not the case in other countries around the world, and certain events triggered by COVID then made it exposed that we can use those tools for helping in decision making. So I can see that and I would agree that that's a positive thing, and that it might actually make health economics more visible for areas where that was not the case, particularly if people start understanding that that you need to make decisions, and health economics can help you to make decisions more informed. So that's true. If I need to, so that would be one sort of advantage, one thing that I can hopefully I see, like, and I agree with you. I think in terms of advancements, I hope that we will see a little bit more of the AI discussion bringing into health economics as well. And that is certainly going to be an interesting debate, which at the moment is happening, but it's not happening on such a global scale that is happening in other sectors. And the reason is because we still got methods that I guess rely on humans a lot, but I'm not sure whether that's going to be always the case. Obviously, I'm not an expert in every single aspect of health economics subdiscipline, but in the area of cost effectiveness analysis, which is the one that I spend quite a lot of time on, I think we probably are going to see a move towards going beyond health into how we make decisions about sort of healthcare, and we've seen some developments of that. It would be interesting to see what is happening in the US with the qualities, how that transform into something different that may or may not be adopted, globally. So there are still exciting times ahead. But I guess it's the AI one that I've got on a personal level, I think, sort of more interest.
So more ChatGPT tools to be used in research.
Well, maybe we just need to ask ChatGPT about what is the research questions that we need to do.
Yes. So coming to the final question, what is your advice to all listeners in early career research on how to do the research from starting till the end? And what will be your, as you have gone through all this process from being a researcher? So what will be your final, or what should I say, advice and your final wishes to them
I see.
in this great,
If I can give,
yeah,
if I can
please.
give one tip, it is important to work with good collaborators and have good mentors that they understand first of all, understand you, your needs, and how they can really guide you through the process. So having good supervisors, and supervisors that not only know about the research, but they also understand the human element that you're a researcher, but you're researching in the context of your day-to-day life, your family, personal circumstances. That is very important for you to be able to essentially be comfortable going in your career forward. So it's the identification of good supervisors and mentors and colleagues that I actually can provide the key advice when you need the most. I think for me that's crucial. And the other one is just don't be afraid of asking questions. Just ask questions. When you don't know something, of course, you need to make sure that you have read a few things before you ask the question, but always ask questions. And then if you can, just try to talk to people who are good in methods and try to learn from them as well. And get to understand methodology in a way that you are not afraid of using tools. And if the new tool comes, you know how to use it, whether this is a new regression method or a new way of presenting sort of econometric data of some sort. So get yourself always up to date in training. So you will always be training. So I think that would be my two cents of advice for today, Gopal.
Yeah. So, as a researcher, should be a good child because children ask so many questions. So you should, for me, you should have a children mind to observe and ask
Yeah.
many questions. It was so pleasure
Yeah. You
talking
need to
to
be
you.
curious. Oh no,
Yeah.
pleasure be mine. Thanks a lot for
Yeah.
having me, and hopefully you will be able to use something of what we have discussed.
Thank you, Dr. Oliver, and hopefully we will see all of you at the IEA Congress Bali this year. Thank you, Doctor.
Looking forward to. No problem, not a problem. Thanks a lot. Thank you.
Thanks.
Looking forward to. No problem,
you.
not a problem. Thanks a lot. Thank you.
Thanks.